Hello and welcome to this week's Pandemic Podcast for Educators. I'm Gawain.
I'm Karam.
And I'm Merike.
Please do subscribe if you hadn't already using the button below. This week we're going to be talking about a new report that's just been released on how to make our schools and colleges safe. The report's been produced by Independent Sage, working with the Eagle Education Research Group. And we're really pleased to be joined today by Steve Reicher from Independent Sage and Terry Wrigley from the Eagle Education Research Group. So Steve and Terry, you're very welcome. And to start us off, Steve, could you tell us a little bit about this report? What's the report about? What does it inform us of?
Okay, well, let me give a bit of context. I mean, a while back in the summer, we released a report on safe return to work, and it was looking at workplaces in general, and it was making the point that the government, when it announced, the release of the first lockdown, basically handed over responsibility to employers, to owners, and just said, make your premises safe. And it didn't have a robust regulation regime, firstly, to help people to make places safe, and secondly, to make sure and inspect the fact that they were safe. And it became clearer and clearer that in many ways, exactly the same thing was going on in schools. So again, Boris Johnson got up early in the summer and waved his hands and said to schools, said to head teachers and governors, make your schools safe. All right. But handed over responsibility. I mean, you could go further and say abdicated responsibility. And it's all very well to say, make your premises safe, but how on earth do you do that? I mean, when you're in a building with only so much space and only so many teachers and so on, you actually need to give practical support, advice, and resources to make that possible. And the consequences of not doing so have become incredibly clear. I mean, the first is that our children are taught in classrooms that are still crowded. And remember, the classrooms in the UK are about the biggest in Europe. They're almost twice as big as they are in Scandinavian countries. So they're crowded. They're pretty stuffy. There isn't much in the way of social distancing or ventilation or safety in general. And we're seeing the results right now. The results are that infections are spiking. They've gone up 50-fold since September. That the group in the population with the highest rate of infection are school-aged children. And now we're seeing more and more kids off school, nearly 1 million. Okay, so in effect, through their negligence, they've effectively closed education for 1 million children. And our sense was, I mean, first of all, that's a national scandal. And secondly, we need to think much more about how to get schools safe. I mean, a lot of the debate is, should schools be open? Should schools be closed? But that misses the point that we all want schools to be open for everyone. For that to happen, they have to be safe. And for them to be safe, we need a government that doesn't wash its hands of the problem, but actually gives clear support to schools to make it possible. And so that's basically the logic behind the report.
Right. Okay. So Terry, a report essentially that's been made necessary because government has abdicated its responsibility to make our schools safe. So you've been working, you and the Eagle Research Group have been working with Independent Sage on how schools can be safe. Tell us a bit more about that.
That's right. First of all, just to add to what Steve has said, the crisis has been particularly in secondary schools with that figure of 50-fold increase and the worst infection of any age group. But in primary schools too, infections have been going up and up, more gradually. I think it's still 11-fold increase since September. One of our group actually issued a report earlier, but we timed it so badly at the end of July, everybody was just off on holiday and so on, that it didn't receive the attention that we'd hoped for. I think there are quite a lot of issues here. I mean, we were very conscious that class sizes in England are the biggest almost the biggest in Europe, particularly in primary schools. And so when the Danes, who were the first to send children back to school after the first wave, they divided classes of 20 into two.
Yeah.
And meanwhile, we
So
maintain
different.
classes of 35.
Yeah, so
So
different from what we've got here. And class sizes keeps coming up as a recurring theme. We keep hearing it from teachers, from support staff in schools, that the class sizes really are the issue here, because it makes social distancing impossible. We
We
Absolutely.
were told in the guidance to sit the children in rows facing forward. All right, try getting your tables that normally are arranged in groups to fit in rows in your classroom, which square footage is smaller than most classrooms elsewhere in Europe, yet we have more children. It's nigh on impossible. We've got some really interesting wonky angles going on in ours to try and actually fit them all in.
well, it's also fairly crazy, is that, because I mean, almost suggesting the virus only travels in straight lines.
Yeah.
Well, it is. This is one thing I was going to pick up on. Like, the advice that has come out from government seems to be of the most valueless bits of suggestions. The kind of thinking, back of an envelope type thinking. No thought has been put into this. So, I mean, Karam, you must be welcoming the fact now that these two organisations have put some serious thought into how schools can be kept safe.
It's been really there's already been quite a good response as well. I see that our school have put out a statement already after the response of the Independence Age meeting today. Kevin Courtney got hold of me earlier to say that he's now talking to Jeff Barton about several of the issues that were raised as well. So hopefully this is the start of some more pressure on government to actually consider safety in school, and in particular the issues that were raised in the meeting today regarding the clinically extremely vulnerable, who the government now believe can go back to schools in a week's time.
Absolutely outrageous. So Stephen, Terry, tell us a bit more about the practical measures. What kind of things does this report recommend? What are the measures to be taken in schools?
Do you want me to start off, Steve?
Well, let me start off with just one, because I think at one level it's very simple, but at another level it shows the difference between what's being done and what could be done. So clearly, distancing is a critical issue. It's a critical issue in terms of stopping transmission. There are all sorts of things you could do. You could divide classes. You could have blended learning. Of course, for blended learning, you'd have to have the IT so kids could work at home. And I still am bemused by the fact that the day after the government brought in a responsibility to be able to teach kids who are off, it cut computer provision by 80%. I mean, that's not only not joined up thinking, that's about as disconnected thinking or disconnected practice that you could come about. But again, if we look at Europe, we see all sorts of creative solutions, and it's the lack of creativity, it's the lack of thought by this government that frequently bemuses me. So one thing you could do, which, as I say, others have done, is number one, to hire more teachers for retired staff or people who've left to come back, as indeed they have in the medical profession, to hire spaces. I mean, there are so many spaces in our towns which are now empty. Actually, if you're in a university town, many university lecture theatres are empty because there's online teaching, and you could use those spaces in such a way that then you would have more space for the same number of kids, and you could actually distance them. There are so many ways in which you could do this if you combine, first of all, a sense that you've got a responsibility to do it. Secondly, a concern about the consequences. Thirdly, being in touch with what's actually going on instead of the fantasy that things are safe. And fourthly, we're prepared to put some resource into it. But of course, that resource would be money well spent, because the amount you'd be spending on it would be far, far, far less than the costs of allowing infection to spread and the impact on our society and our economy by such negligence.
It's the financial and the human impact of this failure to act, isn't it, Terry?
Yeah, I agree. I mean, with extra space, you could do things, as well as the point Steve's been making. You could do things like have an experienced teaching assistant and a teacher working next door to each other with half-size classes, you could be bringing, with extra finance, you could be bringing in retired staff to assist with distance learning, because the likelihood is that many will be medically vulnerable. So you can do all of those things. We're arguing that it's almost in the document that DFE issues and constantly update. They minimize everything. They make it seem as if schools can sort of choose between distancing and ventilation, when in fact you need to max on both. And there are statements like, just open a few of the upper windows, you know, if you got that choice, so that you won't cause a draft. Well, for heaven's sake,
That's the point.
That's the point. You want a draft. You want to change the air.
There has to be airflow, yeah.
Yeah. and that, even that sentence about keep the kids wearing uniform, maybe with an extra bit of indoor clothing. They should be in winter coats, and there should be kids who can't afford warm winter clothing. You know, could be provided.
Yeah.
We had a meeting last night within Stockton, and one of our members in a secondary school was saying that their academy trust will not allow staff or pupils to wear their coat in the classroom. So the amount of layers that they are now all wearing under their uniform, I'm amazed they can fit through the door, to be honest, how she was describing it, the amount of layers that they're having to wear, all because the Academy Trust is insisting that they are still in uniform and not wearing their coat. It's utterly ridiculous.
But it is absurd what's focused on here, isn't it? That uniforms are vitally important, and yet stopping the spread of an infection that is killing people seems to be a solve. Well, open a few windows near the top. Terry, I just want to take you back to something you said as well. With this creation of extra space, you clearly need additional staff. And I know you mentioned the use of support staff potentially to help break groups up, and also retired teachers. But I think there's another huge pool of people here. We have many supply staff who are currently not receiving work because schools are concerned that where you've got people traveling from one school to another, that potentially could spread infection. But the kind of answers you're talking about would mean a need for longer contracts, wouldn't it? It would mean employing a member of supply staff for an entire term, or indeed for the rest of the year, in one building, in order to help reduce class sizes and allow social distancing. So surely this is the answer. We've got lots of staff in need of work. We've got class sizes that need reduced. Surely the answer is that investment could pay for those teachers to come and teach children.
Wasn't this a problem in old people's homes as well, with a lot of staff, and in hospitals? You know more than I do on this, Steve. But
oh, absolutely. I mean, the thing that came over, and actually, you know, in many ways, this pandemic is like a barium meal that reveals all the inequalities and all the failures and all the consequences of austerity. So, you know, we know our lack of preparedness in terms of a testing system, in terms of PPE, in terms of emergency hospital beds and so on. We've seen how those have reduced over the years, and we're seeing equally clearly in schools. It's the lack of teachers and the large class sizes. It's the the really old stock of buildings, a lot of which don't have proper ventilation or even the facility to open windows. It's the precarity of staff who have to take several jobs and move between places, and mobility. I mean, it's pretty logical, really. You know, mobility spreads disease, and it's a bad idea. And all these things reflect, I think, systemic weaknesses, which we all knew about, and you knew about far better than I do because you're in the system. But at the same time, which have been basically suppressed. Those realities are being suppressed, and now they're coming back, and they're hitting us in the face really hard.
And I think one of the things that's come across very strongly through all of this is the damage through privatization, which of course I think Independent Sage have really highlighted very strongly, that instead of rebuilding public health, It's just been handed to the privateers, these various accountancy firms that have made their fortune from local government already.
Yeah, I mean, for me, the failures of the pandemic reflect three fundamental ideological attitudes. I mean, the first is the neoliberalism, which says the private is better than public. And when it comes to contact tracing, for instance, we know the private system isn't working and the local public health system is far, far better. And in the same way with schools, you need the support of the local authority to give advice, to give help, and also to inspect, to make sure all schools are safe, right? And that's missing. So first of all, as I say, that neoliberalism is a problem. Secondly, the laissez-faire, which says, oh, well, look, government doesn't do anything, it just hands it over to people to do things. No, we need government support, as we've been discussing, in terms of the resources, so you can distance. The resources, so for instance, you can make sure that if kids go home, they're going to have IT, so they can work. So that's the second problem. And the third problem is a paternalism that they have, which is about telling people what to do and telling them off if they don't do it well, but not acting in partnership with them, not giving that support that's absolutely necessary. And part of that paternalism is some ridiculous forms of rigidity. We've talked about, those various forms of rigidity, a rigidity about uniform, but then more serious forms of rigidity, like saying you can't have blended learning when it might be necessary to distance classes, or a rigidity in terms of changing the exam system, which we've got to do in order to make sure there isn't a disaster next summer. So it's that complex of ideological views, as I say, of neoliberalism, of laissez-faire and paternalism, which is being revealed as causing all sorts of problems in this pandemic.
Yeah, and it is these ideological approaches when the practical solutions aren't being taken because for the government, they look too much like a kind of society that they don't want to admit works. People looking after each other, people working together, investing in public services. Karam.
I think that they nailed their colours to the mast quite early on when they came out with the statement that children aren't infectious, but children are going to be safe, that schools are going to be safe. They repeated that mantra so much. I think that they're worried about saving face now. If they turn around, and that's what a lot of the talk about masks in classrooms. They don't want masks in classrooms because if children are wearing masks in classrooms, there's an acceptance that there is a risk in schools. And they spend so much time on their messaging that now the idea of turning back on what they've already done is as far as they're concerned, their image, their profile is probably more important than safety. That's how it comes across to me.
Yet we see from France, for instance, that France, its schools are open, its R rate is going down, they don't have a problem. Why? Well, because they're wearing masks. So in many ways, the issue is precisely that, it's not one ideology against another ideology. I'm not against their ideology because it's an ideology. I'm against their ideology because it gets in the way of these very obvious and very simple solutions. And in the end, everything that's in the report are actually just very simple and very practical and very effective ideas about how to keep everybody safe in school. There's nothing, particularly complicated, and there's nothing particularly political about them. But in order to be able to implement them and keep people safe, we've got to get over a politics that stands in the way of it.
Yeah,
I think so. Put his finger on something there. It's the contrast between the laissez-faire and the interventions which actually hinder people from taking responsibility. That doesn't just happen in terms of the number of schools who've been persuaded only to send the children who are sitting next to the child who's infected home. And that varies enormously. But it's, if you've got bubbles, then the whole bubble should be away. The infection spreads across the air and all the rest of it. But I think the classic one is just the excitement in the last few days when it was since Hull, with a real peak in the numbers, suggested that they switched to sort of blended learning, and the outrage from the government because this is so visible and it's such a clear sign of the mess that's been made. I mean, we
Yeah.
signalled up in July that it's very difficult to imagine many secondary schools with a high level of infection operating safely with all the pupils on site. We didn't ask for a rota system. What we saw it as was, we suggested a system, among others, where if secondary pupils could have a 2-hour, 2.5-hour lesson in the morning in one subject, another subject in the afternoon, the local kids going home for lunch, not mixing around, and you ended up with like 7 half days and 3 half days doing further work at home around those subjects. You know, that's eminently workable. And yet the government are absolutely outraged by the very suggestion. And even, let's not forget the FE colleges, even trying to stop distance learning with 16 years plus.
And this is a concern, isn't it? It's not that they're not intervening. It's that they seem to be actively intervening in order to stop solutions from happening. And that's the bit that I don't understand. It's so ideologically driven that not only are they not providing any useful guidance or support or indeed investment for schools, but when schools do try to do exactly what they've been asked to do, make themselves safe, do the best by their students, ensure every student's supported and gets an education, the government intervenes to make sure it can't happen. It's absurd. Merike.
There was something in the news earlier on today, I think I saw it in Schools Week, that the DfE will actually start giving some form of funding to pay for staff who need to be covered because they're having to be off due to COVID, but only after it's been a certain length of time. So by which point a school's insurance policy would probably be kicking in anyway.
I mean, that reminds me of, you know, what in this pandemic, one of the biggest problems is that people who are asked to self-isolate don't self-isolate. Okay? And the reason why that is because practically it's difficult to do. So the government have said, okay, they will pay up to 500 quid for people who have to self-isolate. But there are so many criteria that actually huge numbers of people don't get it. So in Liverpool, for instance, where they've been doing the mass testing, well, only 4% of people in the most deprived areas got the test. Why? Because they couldn't afford to find out that they were infected, and 80% of applications, 4 out of 5 applications, are rejected in those ways. And so the problem I have is that, yes, there'll be a headline saying we're going to support you, but it's done in such a way that practically it means nothing, and you have to jump through so many hoops. In the end, you don't get the money. So in the end, the money doesn't do the practical thing it's meant to. It's just a headline to give good publicity. It's empty and it's meaningless. And I think,
and what we need isn't the headlines, it's real action, isn't it?
Absolutely.
We're almost at time now, but I just want to say, so Terry, first of all, we've got this report, it's out there. Obviously, we want people to download it. I believe it's available on the Independent Sage website to download it, to read that report. But then practically, what can we do? Having read the report, what should we be doing?
Practically, I think in schools, the first step is probably to review the current plans and identify the resources that would be needed to make those places safe. And I think that's probably the first thing, and say that loud and clear and in public. I think the second thing is, what is the second thing? Sorry, it's just slipped my mind. I mean, Independent Sage has put this document out for consultation. I think it is important to sort of send the feedback in, add the comments, let the local press know just how bad the situation is, and tell the stories.
Yeah, so we make sure that awareness is there. Steve, what should people be doing now? What would be your message?
Well, to echo Terry, that before you can solve a problem, you've got to recognize that there is a problem. And all sorts of efforts are being put in to try and hide the extent of the problem by denying that children can be infectious, by trying not to send kids home when they've been close to those who are infectious, to limit the numbers. There's an attempt to put their head in the sand and ignore the seriousness of this. And it's not just about the impact on children and staff, although that's huge. And as I say, let's not forget that 20% of our children are being denied an education right now. They're not at school. 22% of secondary school kids. And the irony is that the refusal of the government to allow schools to take the sensible measures because they want schools to be seen to be open is actually closing education for so many people. So we've got to show there's a problem. I'm not a teacher, and I found it remarkable sitting in the Eagle Group and hearing the stories from teachers, awful stories, horrible stories that everybody should hear. So everybody knows the level of the issues, and then combined with Terry's point about providing a clear solution, this is what we could do, and these are the resources that are needed. I think we need to drive this up the political agenda so it can't be ignored anymore. We've got to bring it into the open, and hopefully the report and the briefing that we had in Indy Sage today and this podcast will help do that. So thank you very much indeed for inviting me. It's been a real privilege to be able to talk to you.
Well, thanks so much for joining us. Driving it up the political agenda, that's the key. Merike, Karam, you'll be doing that, right? Pushing that report out to members.
Absolutely.
Yeah. Excellent. Okay.
I'm going to be rude and rush because I'm now going to have to run to my jab. But it was a
no
real
worries.
pleasure.
Thanks very much, Steve
Thank you.
and Perry, for joining us. Merike and Karam, thank you. Bye bye, everybody.